Module 1. Module 1, Introduction to Nurse Assistant. Statement of Purpose. The purpose of this unit is to introduce the student to California Code of Regulations, Division 5, Title 22, which regulates healthcare facilities, and to introduce the roles and responsibilities of the nurse assistant, including requirements for nurse assistant certification, professionalism, ethics, and confidentiality. Performance standards. Objectives. Define key terminology. 1. Activities of daily living, ADL, sheet. 2. California Code of Regulations. 3. California Department of Public Health, CDPH. 4. Citation. 5. Confidentiality. 6. Dignity. 7. Ethics. 8. Health and Safety Code. 9. Health Insurance Portability and Accountability Act, HIPAA. 10. Insubordination. 11. Job description. 12. Long-term care facility. 13. Mandated reporter. 14. Medical. 15. Medicare. 16. Nursing facility. 17. Omnibus Budget Reconciliation Act, OBRA. 18. Privacy. 19. Professionalism. 20. Scope of practice. 21. Skilled Nursing Facility, SNF. 22. Title 22, Division 5. 23. Violation. Patient, resident, and client are synonymous terms referring to the person receiving care. CNA Module 1 Vocabulary Sentences for Adult English Learners. Instructions for students. Practice reading these sentences aloud. Pay attention to the bold vocabulary words and how they are used in context. These words are important for your CNA certification exam and daily work. The nurse assistant must complete the activities of daily living, ADL, sheet every day to record what the resident ate, drank, and did during the 24-hour period. The California Code of Regulations contains official rules that all healthcare facilities in California must follow because they have the force of law. The California Department of Public Health, CDPH, inspects nursing facilities to make sure they follow state health and safety regulations. When a healthcare facility breaks important rules, it may receive a citation with monetary fines from the state of California. Confidentiality means you cannot share a resident's personal or medical information with anyone except authorized healthcare workers. Every resident deserves to be treated with dignity, which means showing respect and ethical treatment at all times. Ethics are the principles of right and good behavior that guide how healthcare workers should act in their jobs. The Health and Safety Code contains laws and statutes about health and safety that form the basis for California's healthcare regulations. HIPAA, Health Insurance Portability and Accountability Act, is a federal law that protects the privacy of patient health information. Insubordination occurs when a healthcare worker deliberately disobeys a lawful order from their supervisor. Every CNA should read their job description carefully to understand their specific duties and responsibilities. A long-term care facility provides daily care and 24-hour nursing services for elderly, sick, or disabled people who cannot care for themselves. As a mandated reporter, A CNA is required by law to report any suspected or witnessed abuse of residents. Medical is a state-funded program that pays medical costs for people whose income falls below a certain level. Medicare is a federal program that helps people over 65 years old pay for their hospital and medical costs. A nursing facility includes skilled nursing facilities and intermediate care facilities that provide specialized care under California regulations. OBRA, Omnibus Budget Reconciliation Act, is a 1987 federal law that sets minimum standards for nursing assistant training and resident care. Privacy means protecting residents from body exposure and keeping their communications, visits, and medical records confidential. Professionalism is a code of conduct that requires employees to meet or exceed performance standards in their work behavior. Scope of practice defines the specific skills that licensed and certified healthcare workers are legally allowed to perform. A skilled nursing facility, SNF, provides rehabilitation or long-term care for residents who need specialized medical attention. Title 22, Division 5 contains the specific California regulations that apply to all community care facilities in the state. A violation occurs when someone breaks a regulation or law, either intentionally or unintentionally. Module 1, for CNA Dialogues for English Learners. Dialogue 1, First Day Orientation. Setting: a new CNA meets with a supervisor at a skilled nursing facility. Supervisor: welcome to Sunny Valley Nursing Facility. I'm Maria, the charge nurse. Are you ready for your first day? New CNA: yes, I'm excited but a little nervous. I want to make sure I understand my scope of practice correctly. Supervisor: that's a great attitude. Your job description is very clear about what you can and cannot do. Remember, we follow California Code of Regulations, specifically Title 22, Division 5. New CNA: I studied that in school. It's regulated by CDPH, right? The California Department of Public Health? Supervisor: exactly. Now, let me explain your daily duties. You'll be helping residents with their activities of daily living. We call that an ADL sheet. This includes bathing, dressing, and feeding. New CNA: I understand. And I know that confidentiality is very important. All patient information is protected by HIPAA. Supervisor: perfect. Remember, every patient, resident, and client, these are all the same thing, deserves to be treated with dignity. Professionalism and ethics guide everything we do here. New CNA: thank you for explaining everything clearly. I won't let you down. Dialogue 2, Discussing Patient Care. Setting: two CNAs talking during a break about their residents. CNA Sarah: how was your shift in the long-term care facility wing? CNA James: busy. I had to fill out so many ADL sheets today. Mrs. Johnson needed extra help with her mobility. Sarah: that's challenging. Did you remember to document everything? We're always being monitored for compliance with OBRA, the Omnibus Budget Reconciliation Act. James: yes, I was very careful. I know that any violation could result in a citation for our facility. Sarah: good thinking. Speaking of documentation, I had a family member ask me about their father's condition today. James, what did you tell them? That's tricky because of privacy rules. Sarah, I couldn't share specific medical information because of HIPAA confidentiality requirements. I directed them to speak with a nurse. James, smart choice. We have to maintain professionalism even when families are worried. Sarah, exactly. Our ethics training taught us that protecting patient information is just as important as physical care. James, this job requires so much responsibility. But I love helping people maintain their dignity while they receive care. Dialogue 3, Learning about regulations. Setting, a CNA student asking questions during clinical training. Student, I'm confused about all these regulations. Can you help me understand the difference between Medicare and medical? Instructor, of course. Medicare is federal insurance for people over 65. Medical is California's version of Medicaid for low-income individuals. Student, okay, that makes sense. And what exactly is a skilled nursing facility or SNF? Instructor, an SNF provides 24-hour nursing care for people who need medical attention but don't require hospital care. It's different from a basic nursing facility. Student, I see. Now, about the Health and Safety Code, how does that affect my work? Instructor, the Health and Safety Code works together with Title 22, Division 5 of the California Code of Regulations to ensure patient safety and quality care. Student, what happens if someone doesn't follow these rules? Instructor, well, insubordination, refusing to follow proper procedures, can lead to losing your certification. More importantly, any violation puts patients at risk. Student, that's serious. I want to make sure I always follow my scope of practice. Instructor, excellent attitude. Remember, as a mandated reporter, you're also legally required to report any suspected abuse or neglect. Student, I understand. Patient safety comes first, always. Dialogue 4, End of shift report. Setting, night shift CNA giving report to day shift CNA. Night CNA, good morning, Alex. Here's the report for room 205. Day CNA, thanks, Jennifer. How was Mr. Garcia during the night? Night CNA, he needed assistance with all his ADL activities. I documented everything on his ADL sheet as required by our nursing facility protocols. Day CNA, good documentation protects both the patient and us. Any concerns I should know about? Night CNA, he seemed more confused than usual. I maintained his dignity and privacy while helping him, but you might want to monitor him closely. Day CNA, I'll make sure to follow up. Did his family visit yesterday? Night CNA, yes, but I reminded them about HIPAA rules when they asked for specific medical details. I directed them to speak with the registered nurse. Day CNA, perfect. Confidentiality is so important. Our ethics training really emphasized that. Night CNA, absolutely. I also wanted to mention, there's a CDPH inspection scheduled for next week, so make sure all documentation follows California Code of Regulations standards. Day CNA, thanks for the heads up. I'll double-check that all our procedures meet Title 22, Division 5 requirements. Night CNA, great teamwork. Professionalism like this is why our facility has such a good reputation. Day CNA, agreed. Have a good rest, and thanks for taking such good care of our residents.